Welcome to the course on Psychological First Aid, presented by Dr. Dawn-Elise Snipes, Executive Director of AllCEUs.com. In this course, we're going to define what psychological first aid is, identify the strengths of psychological first aid, and identify the characteristics of persons who provide psychological first aid. Finally, we will develop a conceptual framework that explains the process of psychological first aid. The basics of psychological first aid. And for the rest of this presentation, I will refer to it as PFA. Psychological first aid, or PFA, helps people establish safety and security, connect to restorative resources, reduce stress-related reactions, and foster adaptive short and long-term coping skills. It's ideal for individuals experiencing acute stress reactions or who appear to be at risk for significant impairment in functioning. The best time to implement PFA is immediately after the event and early phase post-event, so within the first 24 to 48 hours. PFA can be done in a broad range of emergency settings, in either single or multiple sessions, and it can be adapted for use in group settings. The principles and techniques of PFA meet 4 basic standards. They're consistent with research evidence on risk and resilience following trauma. It's applicable and practical in field settings. It's appropriate to developmental levels across the lifespan, and it's culturally informed. PFA has many strengths, including the fact that it's evidence-based and informed. It's provided or practiced in a modular format so people don't get overwhelmed. They're already overwhelmed enough. It uses a lot of information gathering to help figure out what the consumer needs at this point in time instead of just applying a one-size-fits-all model. It uses concrete examples, embraces a developmental framework, recognizing that 6-year-old children are going to need different things than 60-year-old adults. It pays attention to cultural factors, and when you use the PFA handbook, you will have handouts to give them. Immediately after a trauma, when people are in a crisis state, they don't remember things. They need handouts, bullet points, things that they can refer to later. Basic requirements for early intervention providers include a capacity to connect with a wide range of individuals, not just your Yavis clients, but a wide range of people from, again, the 6-year-old to the 60-year-old. There needs to be a tolerance for symptomatic behavior and strong expression of affect. A person who is working with consumers who are experiencing extreme trauma reactions needs to be able to handle anger outbursts, emotional outbursts, extreme crying. People often don't know how to control these overwhelming emotions, so not being afraid of being around someone when they are highly emotional. Also being, aware and using common sense if somebody becomes aggressive to get out of there. But the person needs a capacity for rapid assessment of survivors. You need to be able to go in and talk to someone and get an idea so you can triage the 3, 6, 8 people who are there that need to talk to you and get an idea of who may be being impacted more. An ability to provide care tailored to timing of interventions, context, and culture. Now, what does this mean? We have to tailor our care and our interventions based on the context that we're in. If we're in the middle of the highway, if we're in an emergency room, if we're in somebody's home, if we're in the office, and to the person's culture. What is appropriate to them? culturally is expression of affect, and very strong expression of affect, something that is accepted and expected or not. Some people's cultures say, no, you're supposed to be very self-controlled and self-contained. Just because someone is not behaving in a certain way doesn't necessarily mean that they're not being just as negatively impacted. We need to recognize and respond to emotional numbing. We need to have a knowledge of our own self-capacities. You can't do it all. You haven't been trained in everything. Personally, I know that I haven't been trained a lot in working with children. Now, I can do an initial, triage assessment, let them know that somebody's going to be there to talk to them, but I'm not trained in play therapy. And I probably wouldn't be as effective when working with, maybe an 8-year-old who's experiencing emotional numbing and is 2 weeks out from the trauma than I would be working with an 18-year-old. We need to have an ability to provide clear, concrete information. This is what you need. This is what you need to do. This is who you need to call, and this is when you need to call them, and here's their phone number. Don't leave it up to a person in crisis to use the yellow pages. If it's not right there at their fingertips, it's probably more than they can handle if they're in crisis. We need to also be able to shift from conventional clinical practice. What you normally use in the office may not be super effective on the side of the interstate. So what do you need to do differently? And we have to have a capacity for self-care. We're not going to be on our game if we're already run down. And after we deal with a trauma situation, we have to be able to take care of ourselves and recharge, or we're not going to be on our game for the rest of our clients. Some basics are to expect normal recovery. Don't expect someone is going to develop complicated PTSD and substance abuse and their life is just going to go down the toilet. If you do, you might as well not be working with people in crisis. We need to expect that they have the resiliency to deal with this as long as they have the supports and the guidance. We need to assume that survivors are competent. We don't need to treat them like children or coddle them. We need to give them the tools that they need to accomplish the tasks that need to be accomplished. We need to recognize survivor strengths. Survivors often feel very inept and very out of control, so helping them focus on their strengths, what they're doing well, what strengths they have that they could use to help them overcome the situation, how they've overcome similar situations, or someone they know may have overcome similar situations. Help them focus on the strengths and promote resilience. Encourage them to eat well, to sleep, to get exercise, to make connections, not to withdraw, not to just stay drunk for a week. We want to promote them doing things that are going to help them physically and psychologically recover. There are certain core actions in PFA. Contact and engagement. Meet with them, engage the person so they're actually willing to talk to you. Then help establish a level of safety and comfort. This is not unlike what we do in our offices, but often it happens a lot more rapidly in crisis situations. Stabilization is needed, and that means physical and emotional stabilization. If someone's house just burned down, they've lost everything they own, they don't have a toothbrush, they don't have underwear, they don't know where they're going to live, there's a whole lot of crap going on. So we need to focus on stabilization, because until they know they've got their basic needs met and that they're going to have clothes on their back and food in their tummies, they're not going to be able to focus on a lot of other stuff. So we need to meet those urgent needs. Which moves on to information gathering, current needs and concerns. This is even more compounded If Sally Sue's house burned down and she lost everything she owns and she's got no family and no friends that she can depend on, well, yeah, that's going to be a problem. So we're going to need to find a shelter or something. Provide practical assistance, getting food, figuring out how to get new credit cards, figuring out what they're going to do as far as their job is concerned and how they're going to get to work. And, you know, the whole world has just kind of gotten very crazy and tumultuous. Assist them in connecting with social supports, whether that be Red Cross volunteers who are there to help them out, caseworkers, friends, church members, family, whoever they can connect with that can be there for them and provide some assistance. Educate them about distress reactions and coping skills. You may be in shock right now. This may not hit you for another week. Or you may think it's hit you and you're over it, but then you may be reminded of it later. So what are you going to do when you start feeling out of control? What are you going to do when you start grieving something that happened or getting angry? These are all normal distress reactions. How are you going to handle those so they don't overwhelm you? And help them link with support services, crisis centers, Red Cross, doctors and hospitals as necessary, counseling services, whatever they need in order to feel like they're safe, secure, and have their basic physical, biological, and psychological needs met. During contact and engagement, you want to establish a connection with the affected person in a non-intrusive, compassionate manner. Introduce yourself. Describe your role. You're not there because they're crazy. You're not there for any nefarious reason. You are there to help them deal with the situation because any normal person would be overwhelmed right now. And so if they're feeling overwhelmed, that's okay, and that's your job to help them. Ask for permission to talk. Some people have so much input and so much spinning around in their head. If you're running your mouth, you're just going to completely overwhelm them. They can't take any more input. So ask them, can we talk? And if they say no, not right now, that's fine. Give them their space. Let them know that you're not going to be intrusive. If you're talking, if you get permission to talk, explain your objective to help them get through the early stages of dealing with whatever happened. Ask them about their immediate needs. Do they need you to call somebody? Do they need to pick their kids up from daycare? Do they need to, there's a lot of things that might be going on that they may not even be thinking about. Be informed about cultural norms related to personal contact. Some people are not going to be okay with you walking up and giving them a hug. A lot of people won't be. They also might not be okay with you putting your hand on their shoulder or what have you. So just as you would in your private practice, make sure that you are conscious and multiculturally sensitive. Enhance immediate and ongoing safety and provide physical and emotional comfort. Ensure their immediate physical safety. Food, shelter, medicine, clothing. These are the basics. Some people may have something happen, again, we'll go back to the house that burns down and all their medicine was inside and they have like 17 different medicines they're on. Well, that's going to be their immediate need. So we need to help them figure out how they're going to accomplish that. Provide information about disaster response activities and services. Offer physical comforts. If you're sitting out on the side of the interstate after a major car crash or something, do they need a blanket? Do they need some water? Offer social comforts. They can sit there and be alone. You can sit with them. You don't have to talk. You can call a friend for them. Attend to children who are separated from their parents or caregivers. A lot of times these children will be very disoriented or concerned about mommy and daddy. And when I say children, the age range is pretty broad here, so it's important to make sure that we don't not pay attention to your, 10 to 17-year-olds, because they may be experiencing a lot of overwhelming feelings too. And protect the person from additional trauma and potential trauma reminders. Don't have the cop standing next to you that has his radio going, talking about who died and what was going on. Try not to have the person where they're sitting watching all of the people be loaded onto the ambulance. Try to protect them in the short term. Encourage them to not watch the local news a lot, because they're maybe televising whatever this disaster was, and it may bring back a whole lot of very powerful emotions and memories. Help survivors who have a missing family member figure out how to contact that person. Is there a website where they can post information? Is there the Red Cross, law enforcement? Who do they need to contact to make sure that they can be reunited with their loved one? Help survivors when a family member or close friend has died. The grieving process, especially if it's something that's sudden, is often very complicated. So it's important to prepare them, help them understand kind of what's going on, the phases of grief, denial, anger, bargaining, depression, and acceptance, and the fact that it's not linear. They may be in denial and then get really angry while they're still on scene, and then they go back into denial for a while. They wake up the next morning and just really want to pretend it was all a bad dream. Attend to issues related to traumatic grief. Let them know they may have nightmares, and if they do, how to handle it. That they may have eating or sleeping disturbances. What the early onset signs of PTSD are. Now, you don't want to do this all when you're sitting, first 20 minutes you've met the person. This is modular, remember. First initial contact is going to be establishing a connection and information gathering to make sure the person is emotionally and physically safe. Support survivors involved in body identification. Now, a lot of times counties and agencies will have victim advocates that are especially trained in this, but if not, try to be there with your consumer to help them when they have to make that identification, because it can be overwhelming, because that's sort of making everything real, that the person is gone. And help caregivers confirm body identification to a child or adolescent. So if grandma has gone in and said, yep, that's my daughter, and made the identification, then grandma has to go back out and tell the children and the family that, yeah, that was your mom. And this can be extraordinarily traumatic and difficult for families to go through. No duh. Calm and orient emotionally overwhelmed and distraught survivors. Sometimes when people get completely overwhelmed, they lose track of where they're at and what's going on, and they may walk out into traffic and do whatever. So it's important to get the person into a safe place and help stabilize them. Make sure you have certain talking points for emotionally overwhelmed survivors. What things do you like to go over, or can you go over to help that person kind of focus on where they're at? And be aware of the role of medications in stabilization. Some consumers, there are a lot of people who are living quite well with mental illness, but when they become extremely stressed, they may have an exacerbation of their symptoms, whether it's depression or schizophrenia. We had a young woman in the facility that I work at who is schizophrenic, and she was perfectly stable. And then an event happened that was just completely overwhelming to her, and the psychiatrist had to double her medication in order to get the voices to calm down some and help her get stable again. So it's important to realize that not only can barbiturates and anti-anxiety medications be used to help people who aren't normally on meds, but people who are normally on meds may need a medication adjustment during the initial trauma coping process. It's important to be able to recognize whether a survivor is disoriented or overwhelmed. Some people are very emotionally expressive, but other people may look glassy-eyed or vacant. They call it the million-mile stare. It looks like they're just kind of looking right through you. People who are unresponsive to verbal questions or commands, who seem disoriented, who are exhibiting strong emotional and physical responses, such as hyperventilating, rocking, regressive behavior, shaking, trembling, staggering around and falling on the ground, exhibiting frantic searching behavior, feeling incapacitated by worry, or engaging in risky activities, such as, maybe they've already gotten out of the car wreck, but then they're going back into the middle of this 8-car pileup to try to pull somebody else out who was in the car. And especially if that person is already deceased, may not make a difference. If the person is extremely agitated or losing touch with their surroundings, ask them to listen to and look at you. Look at me, eyes on me. Speak softly and calmly. Orient them to their surroundings. And talk about aspects of the situation that are under their control, hopeful or positive. That one's a little harder to actually work in without sounding really annoying. But the key is to actually get someone to, I need you to stop. I need you to stop and look at me, and we need to talk for a second, okay? I need to get some information. This will help the person sort of shake out of wherever they're at and come back to the present. Identify immediate needs and concerns and gather additional information as appropriate to the situation. In order to do this, you're going to have to form and maintain an alliance with the survivor. Let me help you. This is completely overwhelming right now. Let me help you. Remain sensitive to the survivor's needs and perceptions. You don't want them to feel like you're trying to bully them, but you also want to make sure that they have everything they need. It's a fine line to walk sometimes. Identify individuals in need of immediate referral. If they look as if they're decompensating, that is, they're having a psychotic break, they're becoming suicidal or homicidal, or are having significant medical problems, they're in need of immediate medical referral. Identify components of PFA that may be especially helpful. Integrate survivor education with an informal assessment. So while you're talking to them about what's going on and kind of getting a sense of what their needs are, also educate them about the trauma and recovery process. Help educate them about how all the things that their body is doing right now are designed in order to help protect them. If it's denial, if it's hypervigilance, if it's anxiety, their body is trying to protect them. So what they need to do is figure out how they're going to deal with those. What are they going to do to address their anxiety or their hypervigilance? And identify needs for additional services or referral. Now, medical, psychological, child and respite care is also huge. People who are undergoing a trauma have all they can do to get through life on a day-to-day basis on life's terms sometimes. And if they've got 5 children they have to take care of, that may be more than they can handle. Likewise, some people may just throw themselves into taking care of their children in order to avoid dealing with their own emotional upset. Gather information about the nature and severity of the experience. Identify concerns about the immediate post-disaster circumstances and ongoing threat. If it was a hurricane, there's probably not an ongoing threat. The hurricane's gone. If it was an earthquake, there could be aftershocks. If it was, a drive-by shooting, there could be another one. There are certain things that may recur and certain things that may not. So it's important to help people really rationally look at, is there a continuing threat and what do they need to do to be safe? Identify separation concerns if one of their loved ones has either gotten separated or is missing or is injured and at the hospital. Assess for physical illnesses and the need for medications, both physical and psychological. Identify losses incurred as the result of the disaster. Now, early on, you're going to focus on practical losses. Do you have clothing? Do you have food, shelter, those sorts of things? Later on, you can talk about the more abstract losses, such as a sense of safety or a sense of goodwill or whatever. There are a lot of losses that people incur. Feelings of guilt or shame. Maybe they fell asleep while they were smoking, and that's what caused the house to catch on fire. Or maybe they were driving when they got into the car wreck. Thoughts about causing harm to self or others. If they have thoughts about causing harm to self or others, you need to do a suicide assessment. And if you're not a licensed professional, you need to have them assessed by one. They very well may need to be committed to a facility for observation for 72 hours. They may not, but it's in your best interest to make sure that a licensed practitioner evaluates them. Lack of an adequate supportive social network. If they don't have nobody they can call, then they're going to be sort of up the creek without a paddle, as you might say. So we need to help them identify places where they might find social supports. Prior alcohol or drug use or psychiatric problems, we've already talked about that. And prior exposure to trauma and loss. If they've had prior trauma exposures, this may reignite some of the stuff they haven't dealt with yet. Offer practical assistance and information to address survivors' immediate needs and concerns. Identify the most immediate needs, clarify the need, discussion action response, and act to address the need. So if somebody says they need clothing, identify places where they can get clothing from, such as the Red Cross and thrift stores, and then either give them the phone number so they can make contact, or you make contact for them to see what documentation they might need to bring in order to prove that they've survived a traumatic incident and they need assistance. Connect survivors as soon as possible to social support providers, including family members, friends, and community helping resources. Encourage the use of immediately available support people. Now, these may not be the best support people, the person that they most want to talk to, but this is somebody immediately available. If something happens at the workplace and, some instance of workplace violence, maybe your coworkers are not exactly the people that you would necessarily normally turn to, but if they're immediately available to support you until your family members can get there, then by all means encourage them to help one another. Discuss support seeking. Identify special considerations for children and adolescents. For example, going back to the two examples of the car accident and the house burning down. If they're in a car accident and mom's in the hospital, then the child is going to need somebody to care for them. And if the person who's caring for them doesn't happen to live locally, Then there's a disruption to their school. So what's going to have to be done in order to make sure the child doesn't get penalized at school if they are not in attendance for a week or two? Can they do home assignments? Can they have online classes? What can happen? In the event of a house burning down, the same thing may be true. They may get relocated to a shelter that's not in the same school district, or they may have to move somewhere in order to stay with family while they're finding another place to stay. So their friends may not be around for them, and they may be going to a different school and have to adjust to all of that, which is hard enough when you're not in the middle of a trauma. And model supportive behavior. Provide the individual with information that may help them cope with the event and its aftermath, including information about common psychological reactions to trauma and loss. Talk with children about body and emotional reactions. So, they may wet their bed. What does that mean? They may have a bellyache. What does that mean? And will it go away? Because some children experience a trauma and they wet their bed and they don't understand what that means, and then they're embarrassed and ashamed, and it just makes things a lot worse. Provide basic information on ways of coping, including exercise, drawing, talking to friends, talking to parents. Talk to the person and say, what do you do to cope when things get tough? What do you do? When you get really stressed out, what makes you feel better? And teach simple relaxation techniques. Assist with developmental issues. The person may be dealing with stuff that overwhelms their thought processes. If dad shoots mom, that's kind of something you don't expect, and it's something that's going to impact a child who may witness it. Assist with anger management and address highly negative emotions. Homicidal ideation needs to be addressed and evaluated. Help people figure out how to deal with their anger in a productive way. Anger at themselves, anger at the situation, anger at whatever, because you know what? There's going to be plenty of anger to go around, and they're going to just ooze it if they don't figure out how to control it and use it productively. Address other highly negative emotions such as guilt and shame. We already talked about that. Help them with sleep problems. Help them figure out some of the techniques for sleep hygiene. I'm not about just giving them a pill right away. You want them to try to figure out how they can help themselves. Reduce caffeine. They don't need to be drinking caffeine at 4 o'clock in the afternoon. Maybe they can try stretching before they go to bed. Maybe they need to set a routine so they're not sleeping in until 11 in the morning and then they can't get to sleep at night. Or maybe they need to not take such long naps during the day. And address alcohol and substance use. Link survivors with needed services and inform them about services that may be needed in the future, such as, again, help with a mortgage, filing insurance papers, dealing with the court system, getting transportation, transferring your child's school records to a new school. Some of this stuff may be completely foreign to people and overwhelming. Victims assistance is another one. Help them file for victim assistance if they qualify. In summary, we've looked at psychological first aid as a method for helping people who are in the midst of a trauma kind of get a grasp on what's going on. This is not an in-depth therapy. This is a way to help them assess where they're at, what they need, and take the first steps toward recovery. The strengths of psychological first aid are that they can be deployed anywhere. on the side of the interstate, in somebody's home, in the emergency room, in a church, in a shelter. And they can be provided in culturally and developmentally sensitive ways. People who provide psychological first aid must be able to make emotional contact. They must be able to withstand strong emotional reactions and help identify people who are at risk of developing stronger reactions or developing self-harming behavior. They also need to be good at organizing and helping people get to the nuts and bolts of the practical things that they need to survive the next week, 2 weeks, or a month. This conceptual framework is modular. So if somebody is in extreme crisis and disoriented, no, you're not going to be talking about how to file the insurance paperwork. That's too much. Right now we need to figure out what we're going to do to get to the next hour. So you do what you can in a given session, and it may take several modular sessions to help the person get to the place where they need to be and make the linkages they need to make. But that's okay, because you have the luxury of doing just what the person can handle in a session.